and the room just guffawed. People were fighting over themselves to get to the aisle, to get the microphone to yell at me.
Yeah.
So you can't be that you're treating Navy SEALs or you're treating,
Yeah.
autism with the same therapy. You can't treat, and I said they both have a brain.
In today's video, we're going to be talking about, can TMS therapy make you worse? With me today, I have Dr. Kevin Murphy. Doc, can you tell us a little bit about who you are?
Thanks, Kyle. Yes, I'm a oncologist by training, specializing in pediatric and adult brain tumors with a process called radiosurgery. And the last 10 years, I've spent time working on a personalized approach to transcranial magnetic stimulation.
So, doctor, is it possible that TMS therapy makes you worse?
Well, with standard TMS therapy, patients can have some irritation to the scalp, headache, pain, noise sensitivity. It's a very loud process. It's not tolerable in some of our patients, like the autism patients or those that have auditory processing disorders have a hard time with standard TMS because of how loud it can be. Hearing protection is used in some cases. So that's standard TMS. And what we do in contrast is a thing called PRTMS. We personalize the RTMS. And we do that by giving designer frequencies at different locations in the brain.
Okay.
And we stimulate with less intensity. And that less intensity allows us to give more dose. So we get a benefit of treating in areas that aren't accessible. We get a lower intensity, so a lower side effect profile. And we're actually monitoring the brainwave state before and after we treat and adjusting the dose based upon the response. So as the brainwave starts to change, we start to change our dose so to track the brain's progress. We also add in neurocognitive testing scores to track their symptoms throughout the process. And both those things should be in alignment. I want to see both improvement in score, that you're getting better clinically, and that you have a change in your brain pattern. And we often get both. I'd say 80% of the cases we see both. The brainwave looks better and their scores
scores improve.
Exactly. There are occasions in some patients we don't get any brainwave changes or we can't monitor them very well. Those are my traumatic brain injury patients, patients that have a history of meningitis, encephalitis.
Okay.
Sometimes you can't read the brainwave pretty well or well enough. In addition, the COVID brain, long COVID brain patients.
Interesting.
Yeah, it looks like Lyme's disease. They have a very hypoactive brain state. It's often not able to be read very well by EEG.
But from what I understand, the PRTMS actually treats both of those.
It does. So we treat really a broad range of things. I was giving a lecture on this and created quite a bit of stir when I said, we treat this whole host of things. And the audience got really angry.
Where were you at that?
This was a group of psychiatrists at a state psychiatric society meeting.
Okay.
And I was giving their plenary talk, and I brought up this idea that we're treating these various things, and the room just guffawed. People were fighting over themselves to get to the aisle, to get the microphone to yell at me.
Yeah.
So you can't be that you're treating Navy SEALs or you're treating, autism with the same therapy. You can't treat, and I said they both have a brain.
When that's what you're treating.
So we're treating the brain. We're not treating the phenotype. We're not treating how they individually are diagnosed. We're just treating their brain pattern.
Right.
And if you have a brain, we can tune your brain pattern. And if we tune your brain pattern, you perform better. And that's what we do.
Well, that's the whole point of this, right?
Exactly.
Hey guys, if you found that video helpful, do me a favor, click on this one right here. You'll really enjoy it. Did you click it? Click on it. You're going to love it.